Hi beautiful people of YouTube, it's Jo. I'm here again today to talk about the abbreviations that are commonly used within the weight loss community and specifically weight loss surgery community. So if you have had your surgery, you probably would have heard of most of these terms, but if you're new to your journey, just starting out or just researching having weight loss surgery, then this might be helpful to you. So let's start with WLS, which is weight loss surgery. Pretty straightforward. So it's that can be any of the surgeries that are available to help towards the specific goal of losing weight. The next one you quite often find sometimes on people's profiles. So the next couple will be ones that you might find in people's profiles on Instagram or Facebook or places like that, or within community pages and things. So the next one is HW, which is highest weight. So that'll be your highest recorded weight, whether that be from years ago, currently, sort of HW, highest weight. LW is the opposite of that. So that is your lowest weight. So that could be the weight that you're currently sitting at. That could be the weight that you got down to. But yes, LW is lowest weight. Because lowest weight, LW, is not always the same as CW, which is current weight, because some people struggle with regain and other issues like that. So your current weight can fluctuate. So yes, that's CW, current weight. GW is goal weight. So GW is goal weight, and that's obviously can be a target that you've been set by your doctors or care professionals, or it's your own personal goal. But yes, so it's a weight that you are looking to aim for, whether that's getting back down to a right weight after some regain, or whether it's a weight that you're aiming towards to achieve. Next few are specific abbreviations for the actual surgeries that are available, or some of the surgeries that are available. So the first one you'll quite often see, it's R&Y. So RNY. So that stands for Roux-en-Y, which is a form of gastric bypass. So it is one of the most traditional forms of the gastric bypass, because there are now available different procedures, different techniques to perform a bypass. So a bypass generally means that a section of your bowel has been bypassed. So there is the RNY, Roux-en-Y, gastric bypass, and then there's the MGB, which is mini gastric bypass. That's the gastric bypass that I had. Don't let the mini fool you. It isn't a lesser operation than the Roux-en-Y. The way I explain it, and I will do a separate video on this subject, but basically it does perform the same job as a Roux-en-Y, in the fact that it works on restriction of the volume of food that you can eat, and it also works on malabsorption from the bypassed section of the bowel. So that's MGB, mini gastric bypass. Then you have a VSG. So VSG stands for vertical sleeve gastrectomy. So that is certainly in the UK, it tends to be alongside the Roux-en-Y as one of the most popular forms of weight loss surgery. The vertical sleeved gastrectomy doesn't have any of the bowel that is bypassed, so it works predominantly on restriction of the volume of food that can be consumed by the patient that's had the procedure. So that's VSG, vertical sleeve gastrectomy. Okay, and then you've got some people abbreviate a gastric bypass as a GB. So yeah, but so that's a GB, gastric bypass. Okay, and then one of the lesser known, less common weight loss surgery is a DS, or sorry, abbreviated to a DS, which is a duodenal switch. It's a very, how do I say, it is an extreme form of weight loss surgery. It is highly effective for those who are extremely overweight, and you know, some people say it's the platinum standard of weight loss surgery. There is more of the bowel bypass. It's higher requirements of protein and fats and things like that because of the malabsorption that's associated with it. But again, I'll probably do a separate video that covers some of the different weight loss surgeries available to you. But yeah, for now, that one was a DS, a duodenal switch. Okay. The other things that you might hear about is LRD or LSD. They are liver reducing diet or liver shrinkage diet. And those are diets that are predominantly to shrink the liver in preparation for the laparoscopy. Put my teeth back in, for your operation, so that it can be formed laparoscopically, keyhole basically. Because your liver slightly overlaps your stomach, they need to move your liver out of the way for the operation, obviously to get to your stomach to perform the surgery. If your liver is fatty or hardened because of your ill diet, then it can be risky to move it out of the way and can cause permanent damage. So surgeons often like you to have a minimum of 2 weeks on a pre-op diet, a liver shrinkage diet or liver reducing diet, for that reason. And again, I will do a separate video on liver reducing diets and the ones that are available and most common that you might hear about along your journey. So then you've got some more that are perhaps specific to the places like Instagram and things like that. Some of the Facebook groups will also do certain days where they'll post pictures up and things like that. So those abbreviations that you might want to know for that community would be TFT, which is Transformation Tuesday. So that tends to be a good sort of side-by-side before and after, or, you know, sort of comparing then and now type pictures, and they can be very inspirational for people that are just starting out on a journey. And it's also a good way of seeing how far you've come, because sometimes your brain plays tricks on you and you can't see it yourself, and it's not until you put those pictures side by side that you then can see what others see, those transformations. So that's TFT, Transformation Tuesday. And then you have also Face to Face Friday, which is FTF. So that is very similar to Transformation Tuesday, but that's obviously predominantly features your face. So a lot of people's faces can, completely transform with the weight loss. So if I know one of my most random, I suppose, compliments, if you can call it that, was from my husband's auntie, who basically said, oh, my gosh, Joanne, look at you. You have a neck. So yes. So my reply to her was, I've always had a neck. But yeah, so the transformation can obviously be, sort of all over our bodies and faces and features. So Face to Face Friday features our faces. So yes, so the other one that you might see as well, that I briefly spoke about in my last video, was NSV, which is non-scale victory. And as I mentioned in that one, basically we can get very much tied up on the number on the scale, basically, and it can be disheartening when you feel like you're doing everything that you should be doing, sort of, and that number isn't moving, or it's going up, and you can kind of get a bit obsessed with it. So NSVs are a good way of sort of having a bit of a check-in, really, with your brain, in that, realising how far you've actually come, what you can achieve now that you couldn't achieve previously. So those can be very much personal to you. There's a few that tend to be quite common within the community, and those will be, sort of reaching a certain goal in terms of clothing sizes. It might be a case of, fitting on an aeroplane seat and not needing an extender belt. Sort of that kind of thing, being able to walk or run a certain distance. But NSVs are very much personal to yourself, and they are as varied as everybody is varied. So I hope these little abbreviations and a bit of an insight into the language and, sort of the language and acronyms that are used within the community is helpful to you. If not, thank you for just listening to me ramble for 13 minutes. But yeah, so I hope this has been of use to you. If you can think of any that I've either missed out or that you've come across that I've not covered, pop them down below in the comments section, and I'll reply to that. Or sort of if you've got any questions, if there's any other subjects that you want me to cover that I haven't mentioned about, again, pop it in the comment section, and I'll address them as soon as I can. And I hope you're all well, enjoying your weekend, and I will speak to you all soon. Take care and have a lovely day.